Hello everyone, my name is Daritza Rosario and I'm a student nurse at Cedar Crest College. So today I'm going to be talking to you about respite care in relation to caregiver stress. And the reason why I chose this topic is because I do currently work in home care and families report that the use of these services provides them with a sense of relief. So my PICO question is, in caregivers of dementia patients above the age of 65, how does the use of respite care services in comparison to not using these services reduce the incidence of caregiver stress? So the significance of the problem. So within the U.S. population, there's going to be an increase of patients with dementia, causing this to become a major public health dilemma. Also, family caregivers have made significant personal sacrifices to keep their family members at home due to this being the older adult preference, as well as the increased cost of assisted living facilities. And because of this, family members caring for a relative with dementia can encounter complex and stressful life situations that can lead to adverse health outcomes. So my literature search process. So two databases that I used included Science Direct and EBSCOhost. Some keywords were dementia, caregivers, caregiver stress, caregiver burden, and respite services. And limitations were full text availability, peer-reviewed articles located within the United States, and publication date range from 2011 to 2019. This yielded results of 51 articles, and out of these articles, 3 were chosen based on the level and quality of the evidence. So the first article is by Fields, Anderson, and DeBelko-Shoney, and it is titled The Effectiveness of Adult Daycare Services for Older Adults, a review of the literature from 2000 to 2011. So the purpose of this article was to examine and review the effectiveness of these services in attention to the caregiver and participant outcome. This was a literature review design of 61 peer-reviewed articles. The independent variable was the use of adult daycare services, and the dependent was caregiver stress. Various instruments were used, such as Medline and Google Scholar, and findings showed that the ADS attendance showed benefits and reduction of caregiver burden and stress. Some limitations included the degree of subjectivity and the inclusion and exclusion criteria, as well as the use of larger databases excluding smaller studies of ADS. So the level and quality of evidence, so this is a level 5, and the quality is good due to it being a systematic review. And some of the recommendations made by the author included the implementation of specific interventions targeting that ADS population. So my second article was by Roberts and Struckmeyer, and it is titled The Impact of Respite Programming on Caregiver Resilience in Dementia Care, a qualitative examination of family caregiver perspectives. So the purpose of this was to examine respite care and impacting resilience in the caregiver. It was a qualitative research design of 33 respondents currently using respite, and instruments that were used were 3 research questions by the author in face-to-face interviews. Findings showed that resilience was increased amongst caregivers who used respite care. Limitations included that generalization to the population could not be done, and the lack of education in caregivers of dementia patients on respite services caused a small sample size. The level and quality of the evidence is level 6, and it is good quality, and recommendations by the author included that primary doctors and specialists diagnosing these patients with dementia should include the family and educate them on resources within the community such as respite care. My last article is by Robinson, Bulkwalter, and Reed, and this is titled Differences Between Dementia Caregivers Who Are Users and Non-Users of Community Services. So the purpose of this was to examine non-users in regards to caregiver stress. It was a cross-sectional design of 241 caregivers, and instruments used were scales, 2 being the geriatric depression scale and social provision scale. So findings showed that those who did not use services such as respite care had less social support and reported more depression. And those who did use respite services stated that they have fewer caregiver upset reactions in regards to the dementia patient behaviors. Some limitations included the lack of the geographic and cultural diversity within the caregiver sample, and the self-report survey inhibits the ability to determine response bias. The level and quality of the evidence, it is a level 4 and the quality is good, and recommendations by the author included identifying interventions such as caregiver support mechanisms and local resources, and nurses must connect caregivers to these resources for problem-solving skills. Some recommendations that I noted that would be effective in regards to respite care and caregiver stress included that healthcare providers should enhance their knowledge on resources such as respite care located within their community in order to provide adequate education to the caregivers, And also, screening tools such as the Philadelphia Geriatric Center Caregiving Appraisal Scale should be implemented during routine visits to assess caregiver stress levels. So the conclusion. So findings show that the use of respite services can be one way that family caregivers take time for themselves and possibly avoid the need to relinquish the caregiving role. And also, according to Fields, Anderson, and DeBelko-Shoney, respite attendance can lower caregiver burden and stress, improving the overall caregiver well-being. So thank you so much for listening to my poster, and I can't wait to see your comments.